Achilles tendonitis is a change with time usually and repetitive use of the Achilles tendon. The Achilles tendon is actually the strongest tendon in the body. As you can see here, it attaches the back of the heel here of the foot. The tendon with repetitive use becomes kind of thickened and painful because there are small little tears. And when it heals in this area, the actual tendon that heals a type of scar or bad type of tendon. And so that becomes painful. As the tendon comes down, it attaches to the back of the heel bone, and you can see that there's this very large spur that's developed over time. The spur is actually not the problem. The spur is actually just a reaction to the Achilles pulling on it repetitively. What we really need to address is the Achilles tendon and the problems that it has as far as that thickening or scarring that it has, but we would also go in there when we decide to actually do something about it surgically, we would take this area off as well. So when you do come to see us in clinic, we'll do a good history and physical, we'll get an x-ray, we'll look at the back of the ankle and the back of the heel there, and once we have that diagnosis of Achilles tendonitis, the first thing that we're going to do is probably try to get you to slow down. We want you to stop doing so much activity with the ankle, and that will usually help just by putting it in like a boot or a brace for a few weeks. If you've done all of those things and unfortunately you're still having problems, then we might need to consider doing some further investigation, maybe an MRI, to look a little bit deeper and see what we have going on as far as what the tendon looks like. However, at this point in time, if we're talking about surgical intervention, we would start talking about how to actually repair the tendon. We make a small incision in the back of the heel. We take off some of that tendon that's not very healthy anymore, and we take off the small bone spur. And then we have to probably reattach the tendon with small anchors. The way I like to do it is I add a small synthetic graft to the back of the ankle as well, and we use that to actually give some extra strength to the tissue. And I think that makes it so that we actually move much faster with your rehab process. You go home in a small cast. We see you back in about a week. We change that cast out either to a boot or another cast, but we actually let you start walking immediately. Usually about 6 or 7 days you're putting weight on it again, and then we get you involved with physical therapy. And then usually by about 4 to 6 months, you're back to kind of normal activity, maybe even back to exercise. I'm Dr. Jeffrey Levy, an orthopedic surgeon specializing in foot and ankle surgery with Riverside Orthopedic and Sports Medicine Specialists.